Thank you. I know recently there's been a big concern about the reduction in donor funding to the health sector in Kenya and across the African continent. I need to say that actually the reduction in donor funding began a while ago, and it has only been made worse by the reduced funding, especially from the US government towards health. And as you know, a lot of the funding, global funding to health, targeted especially certain programs, HIV, TB, malaria, and the vaccination programs. And these are the ones that have been impacted with this reduction. And when the money was available, especially from mid-2000s until early this year, we saw a market reduction in number of cases of the major diseases in terms of deaths from the major diseases. But we also saw expansive programs, some of which one would then consider as very expensive to sustain. So in terms of this reduction, I personally look at them in terms of immediate, medium, and long term. Some of the immediate concerns, obviously, is the fact that there has been job losses. And some of the best brains in the health sector who are working within these programs are now on the streets. They are not contributing to the health sector as would be needed. They ran some of the best programs that Kenyans benefited from. Of course, there's been also the impact economically in terms of hospitality industry that hosted a number of activities, travel and all that. But then there's also one other immediate. Some of the data systems in the health sector depended on this funding. And data is so important to inform the next steps. You need data to know how much medicine has been utilized, how much you need to have in the pipeline. You need data to track patients. For example, TB patients, you need to track and know who is taking medication, who has defaulted, who is likely to develop multi-drug resistance tuberculosis. Without that data, definitely we are then walking and groping in the dark. And it's just then a matter of time to start seeing an increase in the number of cases, malaria cases, for example, TB cases, HIV, maybe a return of mother-to-child transmission. And we therefore need to be wary that much as we are now talking about this reduction in what you call strategic and forums like this, but it is going to translate to deaths very soon. And therefore, I think what is important is we need a very honest and sober discussion to say, within our health financing infrastructure, how are we going to forestall that situation that is going to start coming maybe a year or two from now? That, to me, and to ensure that despite the cuts, with the limited resources that we are left with, how can we integrate programs and also target resources where there's maximum need?